The Rundown with Carrie Saldo podcast is funded by Armbrook Village Senior Living in Westfield, offering assisted living and compass memory support with evidence-based treatment for those with memory loss. More at armbrookvillage.com.
This is The Rundown, your weekly news and review from Western Mass. I'm Carrie Saldo. Good morning. It's Friday, November 14th, 2025. Our Rundowners this week: Greg Sukenik, the news editor of the Berkshire Eagle; Larry Parnas, the executive editor of the Springfield Republican newspaper; and new to the panel this week, Bridget Davis, assistant professor at UMass Amherst School of Public Policy. Good morning.
Good morning.
The big national news this week, obviously, Congress reopened the government. Here, Western Mass stories we're going to unpack this morning. Specifically, we're going to look at a surge in vocational school enrollment nationwide, which is making an impact locally, plus an eagerly awaited project in Springfield's North End that is falling apart and leaving questions for many. And we're going to look at Mercy Medical Center's impending suspension of maternity care, which is generating worries about its future. But first, the Olympia Place fire in Amherst this week. Boston Globe's Brooke Hauser put it this way: Fire Chief Lindsay Stromgren was grilling salmon after work Friday night when the call came in about a fire at a construction site across the street from the University of Massachusetts Amherst. He left dinner behind. Captain Chris Goodhind was at his home in Hawley, about an hour away, when he heard a dispatcher talking about explosions via an off-duty alert system. That sounds bad, he told his wife. She packed him some snacks, which he left behind on the counter in haste to get on the road. The two men were among the first to arrive on the scene of the most destructive fire in Amherst's recent history. The massive 3-alarm fire that ripped through the Olympia Place apartment complex Friday, displacing around 230 UMass Amherst students, drew first responders and other support from more than a dozen neighboring towns in the Pioneer Valley and from 2 fire stations in Amherst. Bridget, Olympia Place was off-campus housing for, like I said, are 230, mostly UMass students. You're there on campus. How are students faring right now?
Well, students are really supporting each other incredibly. They're really coming together. They're organizing all sorts of mutual aid kind of supports outside of what the university's doing. And it's hard to actually hear like a young person who's, 19, 20, who's like, well, I'm relatively well off because I've already found housing, because like a roommate got a situation together and found another place. But he, this student lost everything and is like, well, but at least, I actually did have my ID with me. I actually did have my phone with me. Like some people lost, everything. Passports, and they're supposed to travel abroad in January, right? All kinds of things that...
So a lot of degrees of people feeling grateful and luck depending on what they had stuffed in their backpack or in their car.
Yeah, and I think they're facing, the housing costs in Amherst, like the apartments and housing units that are available are more expensive than what Olympia Place was. And so they're really having a hard time figuring out what the long term...
was expensive in itself. Yeah.
Exactly. So...
The numbers here are pretty staggering. 72 apartments, 99,000 square feet that this building that was demolished ended up coming down. 232 people who were displaced. 1 million gallons of water used to fight the fire. Remarkably, no human injuries of either people living in the buildings or firefighters and support staff fighting that fire. Some pets did perish in the fire. The cause of the fire remains under investigation. It's believed that high winds spread from a nearby construction site where the fire started and jumped over to this existing residence hall. This was a massive effort. Jeanette DeForge reported in the Springfield Republican this week, Larry, that the firefighters were still there on Monday, wetting this down because the fire was so hot. And there was this mutual aid from firefighters from around the community. Jeanette also reported, Larry, though, that some fire victims and their families have felt like they haven't gotten much support from the university. Their primary complaint is that there's a lack of people, the university helping them find new housing. 200 and something people lost their homes. People are just heartbroken and struggling. But is that a fair criticism of the university so soon after this happened?
Well, Jeanette was at the scene, as many reporters were, and people were processing this shock. And, in the immediate aftermath of this, there's no quick, easy answers on finding new housing or even a pair of jeans. I think the university seems to have put a pretty robust program together to help them deal with immediate cash aid, clothing. They opened up the dining commons for them to eat for free. I understand the families who were speaking Sunday, really one day after the fire,
Which is when
which was
Jeanette
still
wrote this
burning.
story.
Yeah, I totally understand their sense of feeling adrift there or not getting what they need, but super difficult. You cited the numbers, Carrie. I mean, God, it's just a big problem.
And Bridget, you mentioned the student resources. Go ahead.
Yeah, I was going to say, a student did mention to me in undergrad that that had they not been able to figure out whose couch to sleep on, they wouldn't have known where to stay Saturday night. And I think that is I think it's a tough critique to come around, but it's also, we do have some hotels in the area. We do have some, and I kind of wonder what the immediate response was. I know this was an off-campus housing site, so I know that there's, the degree to which the university will immediately step in, I think is a question. But I think students were a little bit disappointed or worried about those who couldn't find another person to stay with.
And there's sort of multiple efforts going on right now. There's the New to You program, which is sort of a thrift store there on campus. They've been open. They've been very helpful, reportedly offering free things to many folks who are impacted by this. Greg, you were at the hockey game
I was
Friday
at the hockey
night,
game
right?
on Friday night. I did not know this was happening. It would have broken out probably at some point during the second or third period, I think. The numbers, as you were mentioning, are shocking to me. The more than 1 million gallons of water, and I get to thinking about something. I mean, I went to UMass Amherst, in the 80s and 90s, and even then it was starting. It hadn't really started yet, but Amherst has had a housing crisis for a long time, longer than most communities in Western Mass. But it just gets me to thinking about sort of the largely wooden construction of the place, and it's too soon to speculate about causes or what could have prevented this, what could be done. But I think as we think about the rush to build housing, we think about affordability and efficiency. I think we also have to think about the resources that it takes in a worst case scenario, and we have to think about safety.
Go ahead, Larry.
Speaking of resources, one of the things that's already happening is that the Amherst Firefighters Local 176 is talking about staffing, and the town has been wrestling with this. Claims that the costs of adding staff are considerable. There is, I think, one position that wasn't filled for firefighting. Paul Brockelman spoke to Jeanette on our staff yesterday on that. Out of the embers of this is coming up this old question of how many firefighters does Amherst need in a community that is building new housing and including some higher
To serve not only the existing residents in Amherst, but the larger UMass Amherst community, which is a city in of itself of thousands, 36,000 students or so, I think, attend roughly. And then you've got support staff and professors and everything. Greg, did you have something you wanted to add?
I was going to jump in. We went to the town council debates for Amherst recently. The students helped sponsor it from the School of Public Policy. And Lynn, the council president, was definitely talking about the priority that they've had money building to set aside to be adding to the, not just to the force, but to the capacity of the fire department there. But it's gotten kicked. The can has gotten kicked on that for a couple of years, and she was speaking about how urgent it was, and I hope that this brings that. And I also hope, to the point of just building more, there's a real case for intergenerational co-housing right now, and I'm kind of hoping that some folks in Amherst would think about maybe subletting, having somebody stay with them for a temporary or short-term time, and maybe they'll start to see that actually having younger students, a younger student live with them could be a really nice addition to the way that Amherst operates.
It will be interesting to see if that pans out, because I was thinking about the fact that the fire, you lost 200 plus existing housing units, but you've also now lost what was going to be an additional 230 housing beds at the 47 Olympia Place location where the fire started.
That's right.
So lots of questions still here and lots of things to be considering. If you do want to help, the Olympia Place website has a lot of resources right now for places you can donate. The UMass New to You thrift store is taking donations, and the UMass Amherst Foundation is taking donations on behalf of students. Then students can apply to grants. So lots of ways that you can help if you are interested in doing so. All right. Headline here: vocational boom, enrollment surges at career technical schools as students seek skills, jobs, and financial stability. This was a story from the Daily Hampshire Gazette's Emily Klein, quoting here: Gabriella Smith moved from Pennsylvania to Western Massachusetts a few years ago because her family heard about the educational opportunities at the oldest vocational system in the Commonwealth. As a freshman 2 years ago, Smith sampled 4 different trades during a 4-week exploratory period, but gravitated toward collision repair or auto body repair work. Collision repair is not Smith's career goal. She plans to study neurology in college. But her time at Smith Voc has provided a secondary career option, potential job security, and even lifelong friends. Bridget, this story jumped out to you. You brought it to my attention. What struck you?
Oh, what struck me was, number one, that it's on either or between trades and skilled trades and then a 4-year college degree, and they were advanced degrees even. I think students are reading this economy in a really savvy way, which is that, jobs for college students and in summers or even while they're in school are often super precarious. They're not able to be controlled. They don't pay very much. And they're realizing that they could work over the summer and actually pay for their tuition if they get a skilled trade. And that was possible. In 1981 at UMass Amherst, you could work full time in the summer at minimum wage and pay for an entire semester of school.
We just Fresh Marketplace. That's how I put myself through UMass.
Yeah.
And that's a huge shift to that either or. I was thinking back to when I graduated high school, which was the late 90s, and there was not an either or. You were either on a collegiate track or you were on a Voc track. And
you were doing
never
both
the twain.
and.
Yeah,
yes.
Exactly. Never the twain should meet. Craig, what's on your mind?
Well, Berkshire County has, a smaller population, and workforce development has been an issue there for a while. The 2 of the 3 largest high schools in Berkshire County, Taconic and McCann and North Adams, are vocational high schools, and those are schools that you opt into, by choice. So it's, I think that message is resonating, and there's a new high school that's proposed, on track to get built at Monument Mountain Regional High School. They're going to add vocational space
into the existing, more traditional educational curriculum. So we're seeing this fusion. Mm-hmm. Jim Kinney talked about this recently with the expansion of Pathfinder Vocational School. A very creative solution there. Pathfinder has a wait list, as many Voc schools do, as Emily Klein pointed out in her reporting, and Pathfinder is full. Their structure is at capacity. They've thought about adding on. That's not going to work out. They're collaborating with Belchertown, a school that Belchertown is going to shutter. What did you make of that creative solution, Larry?
It makes total sense. They have this space in this elementary school that they can move some of the Pathfinder programs that are less sort of gear and machine intensive over there. There's this capacity problem now. You've got a rising demand, and it's a significant demand, and you can be, Bridget, allowed back on campus today after pointing some of these things out. I think that this is also a factor in this new policy on lottery admissions into vocational schools to make it kind of cleaner and more accessible to all, and maybe not so disadvantaged students who are coming to this idea a little later in their middle school careers.
It's really interesting, too, to look at the pressures here, right? The rising cost of education, which, Bridget, you mentioned, you touched on it, Greg, but also this idea of students getting this hands-on education that they can keep in their back pocket for a rainy day or dive into.
Taconic is adding plumbing next year, and there's grant money available for this, too.
Yeah.
Because government is also understanding that there's need in these trades.
Work in the trades, we all know, provide a really good living. And you come out of college and you try to apply for a job, and an algorithm is the only thing looking at your applications. It's enormously frustrating.
Well, it's dehumanizing, too. I mean, our students, I think, look at even the way that knowledge economy jobs have become precarious, that you're expected to be on email all night long, et cetera. And they're thinking, why do I want to do that? I might want to get a college degree. I may want to even get an advanced degree, but I don't want to put myself in a situation where I have no kind of outlet should my field kind of get attacked by AI, et cetera.
And the pay is attractive. You can do better as a auto mechanic than you can as a journalist, for example.
But nothing is guaranteed. I was thinking about that Smith Voc student who's interested in auto body and collision repair. Is she saying that autonomous driving vehicles are not going to be the thing that they might be?
Well, they'll get crashed.
Oh, okay. There you go.
Those systems failures. She's
Maybe that's
counting
what
on the
she's-
AI not to work out.
She's probably right.
Yeah, exactly.
Yeah.
All right, well, I'm going to take us to a quick pause here. Still ahead, the panel's thoughts on turmoil at a Springfield social service agency and changes to women's health care at Mercy Medical Center, plus scoop sprays and prediction from our panel. If you have thoughts, email the rundown at nepm.org. You're listening to The Rundown here on 88.5 NEPM. We'll be right back. Welcome back to The Rundown here on 88.5 NEPM. I'm Carrie Saldo, joined by journalist Greg Suchenik and Larry Parnas and educator Bridget Davis. If you have thoughts, email the rundown at nepm.org. All right, panel, right back into it. The headline, highly anticipated New North Citizens Council building project in Springfield collapses. Stephanie Berry reporting here for the Springfield Republican earlier this month. Larry, quote, a North End lot remains vacant 3 years after community leaders and elected officials held a ceremonial groundbreaking for the much anticipated Barbara Rivera Community Center. The project, designed to combine all the services provided by the New North Citizens Council in the heart of the neighborhood, was billed as a transformative project for the Latino community. It also was to include health housing, substance and abuse counseling, and child care services for the poor and homeless, a gymnasium, and spaces for community gatherings. Larry, this plan is not moving forward. What's going on?
Oh, boy. They don't have the money. And they most recently lost more than $2 million of promised ARPA money. Mm-hmm. And
which is American Recovery Act money that was dished out from the federal government to local communities during COVID.
Right. Thank you, Carrie, for filling in the blanks there. This is one of those situations where a really highly valued local grassroots anti-poverty community spirit organizations, 52 years old, seems to me to have kind of hit a moment of crisis. And it's not just the Barbara Rivera Center that they broke ground on 3 years ago that is now in jeopardy. There's a new board. The new board has put the long-term executive director, Maria Ligas, on a paid leave. There's a forensic audit underway. And in time, I think the full picture will come out. This also comes after we reported extensive travel spending by Maria Ligas and her deputy director, who also has left his position without explanation.
And neither Ligas or that other employee would talk with Stephanie Berry for her reporting. So a lot of questions remain.
Just quickly add that it could come to light through this forensic audit, which the board fully backed. The decision to put Maria Ligas on leave was very narrowly passed, 5-4. I think the picture could come out that the problems that have sidelined this community center project are more structural than sort of mismanagement. Mm-hmm. But for the community, this is a loved institution that helps a lot of people. It's like 7,000 people they serve every year.
It's a massive
It's important to figure out what happened.
Yeah, and Stephanie pointed out, which I thought was really great context, that this council has grown from operating in a small mobile home on a dirt lot in the 1970s to an agency that employs over 130,000 people and has a yearly budget of roughly $14 million. Greg?
Nonprofit organizations do such important work in our communities, but the thing about them is sometimes the governance and the way that they're run, they're largely run by volunteers and people who might not have expertise in handling, fiduciary responsibilities, the things that boards and executive directors do. So
that's a good point.
But even if they do have professional staff, and even if they do have all of the insights, like they're relying on contracts constantly and donations. But contracts are the big piece of that. And with this federal government situation like that we're in and the major cuts, we should expect that we will see more challenges like this in other social service agencies
You're
very
right,
soon.
Bridget. That's
Absolutely.
Putting stress on all of these nonprofits.
Yeah. And still a lot of questions remain about how this unfolded. Certainly, Maria Ligos was full-time staff there, but you point out Gladys Oyola Lopez, who kind of became the board chair in the midst of all this turmoil, has really insisted on more transparency from this agency because these are taxpayer dollars that are funding, both federal and state dollars, funding this organization, which does a ton of really good work in Springfield, but also some surrounding communities. And so the big question for me right now is like, how are the existing staff faring, and how are the people who are being served? Are they still being served in the full capacity, or is this turmoil impacting them too? I think that's a standing question.
Yeah, they say that they've put some new people into important positions. I mentioned that there were some other staff who were fired. One of them was Maria Perez, who is a Springfield City Councilor, as well as running their housing programs.
And she's suing, though, right, to be reinstated,
correct.
I believe, too. So there's just like lots and lots of turmoil here still standing. All right. Well, certainly I think that this is a story that Stephanie and the Springfield Republican will keep an eye on, and we'll keep watching here. On to some more reporting. Mercy Medical Center's coming suspension of maternity care generates worry about jobs in the future of the Springfield Hospital. That's the headline on reporting by Heather Morris out of Mass Live, quoting, as Mercy Medical Center's Family Life Center announced it is planning to temporarily stop maternity and newborn services in December, the Massachusetts Nurses Association is blaming the hospital's parent company for, quote, inaction, erosion of care, and for a decision that could have lasting impacts. Trinity Health, the organization that oversees this, said the services are stopping December 8th due to significant provider and staffing constraints, including nurses. Certified nurse midwives will continue to provide prenatal and postnatal care in outpatient sites for other people here in Western Massachusetts. Patients can go to Bay State Health's Bay State Medical Center in Springfield. Larry, reaction to this news, yet another challenge in healthcare here in Western Massachusetts.
And it happens to be the hospital that serves the North End primarily. I mean, this is the go-to hospital for Springfield's least affluent residents. It has like an 80% of its patients have their care covered by Medicaid or Medicare, and that's way over the percentage that that hospital analysts consider to be sustainable. And so the real backdrop for this is that as we've reported, Bay State and Mercy are in talks to combine in some way. And
that was something Jim Keener reported back in July.
That's right. That's moving forward. And the Massachusetts Nurses Association, which represents 380 some nurses at Mercy, it's a great union, activist union. They pressed Mercy and Trinity Health on what are your plans? And in the story Jim did this summer about this, the hospital's response was, well, we're always open to combinations and business adjustments that better our community and all that.
They wouldn't address it specifically.
Well, but they didn't rule it out, and there's a door wide open on that. So the issue for people who seek medical care in Springfield is what would happen if Mercy, which is losing money, I mean, as is Bay State, but less so, if it just closed, if it just collapsed. And that has happened in Massachusetts, and it's a crisis.
Greg Sukenik.
I'm just thinking about the way that happened. So it's been 11 years since North Adams Regional Hospital first closed. It's since reopened with Berkshire Health Systems. But, that left a mark. And I'm just thinking about, just you talked about Springfield losing Mercy. I mean, Bay State already has lengthy waits for its emergency room. I can only imagine what would happen if Mercy disappeared. It's troublesome. It's in terms of the overall impact that has not only on quality of life, but employment. And,
it would be hard for people seeking care, and it would also put another layer of stress on Bay State's finances to have to be picking up more people who are paying far less than these services cost.
And circling back to women's health in particular, there is a woeful shortage of access to women's health care in the Pioneer Valley.
Yeah, and I mean, Hampden County's maternal mortality rate is 2 times that of Massachusetts on average. And so there's a huge problem here, right?
That is stunning.
And so the stress that's going to happen in terms of pregnant people, like knowing that they could potentially have to be changing doctors. They're saying that people that are late term right now are going to continue to get care. But it's a lot of stress to be thinking about what might happen and where I imagined having my child, and if that's where I had a previous child, or if that's where my parent had a child, right? You have an image of what this is going to look like, and it's a lot of stress for families to be thinking about this.
Speaking as a woman whose birth plan went completely out the window, I can't imagine having this added pressure as I'm trying to also, go through my daily life and make sure I'm healthy and the baby's healthy. And Bridget, your point is incredibly well taken, because it's a joyous time for a family, but it's a time with stress and confusion, and you just kind of want things to be predictable when it comes to what your plan is to have the baby and where you're going to end up. And I think that it'll be really interesting to watch how, because Mercy at this point has said that this is a pause, right? And that they might bring this care back. But the Mass Nurses Association has raised concerns saying, well, if you pause it, that's just one step closer to being finished. Any thoughts on that?
Well, if pausing means that you've sort of thrown up your hands and given up on the recruitment of the staff you need to sustain this service, then it's over.
Because that has been a contention from the Mass Nurses Association, saying during the contract negotiations, as I understand it from the reporting, the hospital system was saying, look, we're trying in good faith to bring in these extra folks. The Nurses Association has pushed back on that, saying that it wasn't actually doing that in good faith. I think it's been interesting, too, to watch not only for women's healthcare, but Mass Nurses Association in general, whether they're advocating in the Berkshires or here in Springfield in this instance, how often these negotiations become public. And I was thinking about whether or not that helps their hand or just apprises the public of the fact that these negotiations are going on. Thoughts on that? Anyone on the panel?
Well, it should be public. I mean, I believe the Cooley-Dickinson Mass General nurses are considering a one-day strike coming up.
They've authorized it, yeah.
Yeah, I think these are public issues, and whether how much people get paid. Well, I guess in nonprofits that's revealed too.
Tax filings.
Yeah.
When you think about how important these institutions are and what it means when a hospital closes. I have a friend who's was a doctor at Neshoba Valley, and that just the impact on that. I think the transparency is these institutions are too important to not have transparency.
Yeah. All right, well, I'm going to pivot us to our scoop, praise, and prediction portion of the show, where I ask the panel to make a prediction about the news, dish on a newsworthy nugget, or maybe heap some praise on something that they've read that they've really enjoyed. Larry Parnas, for you, scoop, praise, prediction, what's going on?
Okay. The pause in maternity care is not temporary.
That's your prediction.
And that this deal between Bay State and Mercy will come together or be officially over by the end of December.
We will watch that here on The Rundown. Greg Sukenik.
Praise. We've got lots of great new reporters at the Berkshire Eagle, but this goes out to Nate Harrington for his story on second towns with lots of second homes and not a lot of people living in them, and how that affects working people in those communities.
That is a huge issue in Berkshire County, in so many communities. So people can check that out at berkshireeagle.com.
Indeed.
Bridget Davis, welcome to the panel. How about for you, scoop, praise, or prediction?
Yeah, kind of silly, but a prediction. I think UMass women's basketball is going to be 5-0 by the end of the week, with three of those wins being over Harvard, UMass Lowell, and BC. So I think they're going to be
bold predictions here on The Rundown this morning.
They're a great team this morning, or this year.
I absolutely love it. I have praise this week. It was Veterans Day earlier this week. My husband is a veteran, and I think, for all veterans who are here in Western Massachusetts, we never know the extent of the sacrifice that they have provided on our behalf. So just praise for veterans everywhere. That's it for today's show. I want to say thank you to our Rundown panel, Bridget Davis, Greg Sukenik, and Larry Parnas. And just a quick shout out to the NEPM newsroom for a big win at last night's Massachusetts Broadcasters Association Soundbites Awards, taking home first place in the feature story category for their story, Brightwood Elementary Students Build Confidence Through Spirit Tunnel, as reported by Nirvani Williams and edited by Elizabeth Roman. Congrats to our newsroom. I'm Carrie Saldo. Thanks so much for joining us today on The Rundown. You can catch us here every Friday at 9 on 88.5 NEPM. Have a great day, everybody.